Well, good afternoon, and thanks to all of you for being here today. It is good to be with all of you again. Today we have updates on PPE distribution, elections, health data, and efforts to help Virginia restaurants. First, we continue to distribute PPE around the state. Everything from gloves and gowns to masks and face shields to hand sanitizer and coveralls. For example, we've distributed 1.5 million gloves and more than 430,000 N95 masks. Today and yesterday, we shipped several thousand N95 masks for our hospitals. Numerous shipments have been made to localities around Virginia through the health districts and regional health coalitions. These are being distributed to hospitals, nursing homes, and other medical care facilities. And we continue to work to purchase PPE. As I and many other governors have said, that market is chaotic and difficult due to a lack of federal direction. We continue to compete for the same supplies. So far, no Virginia hospital has run out of PPE, but I spoke with several hospital CEOs yesterday, and they, along with all of our health providers, worry that they don't have enough. We look at the data hourly, and we are preparing for all scenarios. Now I have an update on how we will handle two upcoming elections. We have local and special elections coming up in May, and congressional primaries in June, which are statewide. We're in the middle of a public health crisis. We have wrestled with our options, and none of them are ideal or perfect. Elections are the foundation of democracy, and voting is a fundamental right. But no one should have to choose between protecting their health or casting a ballot. Holding in-person elections right now would put the health of voters and our election workers at risk. Therefore, I am recommending that we move the May elections to November. I have had discussions with the Speaker of the House and with legislators on both sides of the aisle about this. This change will require General Assembly action when lawmakers return to session on April the 22nd. Postponing these elections is the best way to protect democracy without endangering the public health or violating the stay-at-home order. In addition, the governor has the authority to move a primary election back by 2 weeks. So I am moving the June 9 primary to June 23rd. I have discussed this with legislators and members of our congressional delegation. Now I'd like to discuss the health data that we collect. In a pandemic such as this, it is critical that everyone has as much information as possible, from the decision makers to the public. Data comes in from a variety of sources, both public and private. Our local health departments, the hospitals, the private testing labs, and more. It is difficult but important for everyone to be reporting the same types of data, so we have a better picture of what this virus looks like here in Virginia. We are seeing racial disparities in COVID cases in places like New Orleans and New York, and we must be able to measure this here in Virginia. We know that long-standing racial inequities in things like access to health care, education, and economic opportunities lead to differences in underlying health conditions. The existence of such inequities is one reason why communities of color, including African American people, are more likely to have some of the underlying health conditions that put them at a greater risk with COVID-19. We need a clearer data about what this means in Virginia. That obligates us to do a better job of tracking racial demographic data of confirmed cases. I have directed VDH, or Virginia Department of Health, to make sure that we are doing just that. It is my understanding that private testing labs and some other private partners are not currently reporting this data. We're exploring ways to make sure that they do. While the coronavirus outbreak is our primary focus, the business of government must continue. That means that my office has been working through the hundreds of bills passed by the General Assembly during their regular session. Our policy shop is working very hard, and I thank them. Our deadline for signing, amending, or vetoing legislation is midnight Saturday, and I am pleased to say that we will meet our deadline. One of those bills is our state budget. We know the budget, as passed just a few short weeks ago, cannot move forward as written. We are expecting a recession with a drastic reduction in our revenues paired with large increases in spending to fight this epidemic. I am working closely with the Speaker and other legislative leaders on budget amendments that will allow us to deal with the changing revenue situation. The General Assembly passed 1,291 bills for me to consider. I thought it might be interesting for those of you that are not familiar with the legislative process to see a bill. Some of our bills are one page, some are longer. Often they're very complex. This particular bill is the Transportation Omnibus bill. It's 83 pages. I tell you this to commend our legislators, all 140 of them, for the work that they do on behalf of Virginia to keep us moving forward. A tremendous amount of work. It's also a tremendous amount of work for our policy folks. And so to all of you, I thank you for what you do. So far, I have acted on 864 of these pieces of legislation, and I'm ready to act on the others in the coming days. We will have more to say on legislation later this week. We also continue to work on ways to ease pressures on businesses such as our restaurants. Today, I've also directed the Virginia Alcoholic Beverage Control Authority to defer annual fees for licenses and permits that would be up for renewal through June. This affects some 6,000 establishments with ABC licenses. If we didn't do this, some businesses that are closed would be in the position of paying a fee for a license that they can't use or losing their license. I've also directed ABC that establishments with mixed beverage licenses, such as restaurants and distilleries, will be allowed to sell mixed beverages through takeout or delivery. This will be effective at midnight Thursday. All Virginia restaurants that remain open are now takeout or delivery only. Allowing them to sell mixed beverages with takeout or delivery orders will help them augment their revenue streams so they can continue to operate and employ Virginians. Finally, Passover begins tonight. This is normally a time for those of the Jewish faith to come together, but please celebrate the Seder only with those you live with or in a virtual Seder, not in a large group. We must continue the social distancing that is our best tool as we fight this virus because science tells us that it's working. Thank you all again for joining us today, and now I'd like you to hear from our Department of Health Commissioner, Dr. Norm Oliver, and following his comments, we'll be glad to take questions. Dr. Oliver.
Thank you, Governor. Good afternoon. I wanted to update you on the numbers on the COVID-19 cases here in the Commonwealth. We have a total of 3,645 cases of COVID-19. This is a 312 case increase over the last 24-hour reporting period. The total deaths now number 75, and that's 12 additional deaths since the last 24-hour reporting period. I'd like to make note of the fact that on our website, we now have a weekly report that will be posted each Monday This past Monday, we posted the first of those weekly reports. These reports include a case description about all the cases that we have here, and that underscores some of the points that the governor was making in his opening remarks. Virginia is one of less than 12 states in the United States that actually report race and ethnicity data on COVID-19. And with that, however, there are a number of challenges that we face. We do not have race and ethnicity data on 53% of the incident cases in the state. That's mainly because labs receiving data from providers who've taken test specimens from patients and sent that in without that racial and ethnic category information with them. And if the labs don't have that information, they can't report it to us. The VDH crews who do the case investigations and contact investigations collect all of that data, and the 47% that we have data for is the data that we've collected. We have the same problem with respect to deaths from COVID-19. About half of the deaths that we have no racial and ethnic data on that. That we can do much more to resolve, because as the death certificates are generated, we can go back and backfill that information in there. With respect to the clinicians, we'll be sending out a letter encouraging clinicians to put down that important racial and ethnic information on their test specimens when they send them in. Based on the weekly report that was posted to our website this past Monday on the 6th, at that time we had racial and ethnic data for 1,381 cases. Of that number, 386 were African American, for about 28% of the cases. Historically, since about 1970, the African American population in the Commonwealth has been around 20%. We had 159 Latinx people who were positive for COVID-19. That comes to a percent of about 12% Latinx. On the mortality numbers, out of the 75 deaths, we have 14 that are African American for a percent of about 18.7%, and 3 who were Latinx for a percent of 4%. And again, about half of those deaths had no such information, so that number could be an underestimate. I will say that in addition to being one of the few states that actually collects this kind of information, we also, I think, are cutting edge in the way in which we're conducting our emergency management. The Unified Command that's leading our COVID-19 response has a health equity work group that is looking at every aspect of what we do in response to this with that lens of equity, diversity, and inclusion. So our logistics, our finances, our planning, every aspect of what we're doing, we're taking those things into account. And that's, I think, historic for Virginia, and for that matter, historic for the whole country. As the governor pointed out, the reasons for these disparities and inequities flow from the existing social inequities in our society that result in a much higher concentration of communities of color in urban areas, close-quartered areas. It results in lack of access to health care, to much higher disease burden with twice the rate of diabetes, hypertension, obesity, and a number of other issues. And these underlying problems then place these folks at higher risk of mortality from COVID-19. And they're also at higher risk of getting the disease, since they tend to be concentrated in the essential industries and are working. There's less social distancing in these communities, less opportunity for teleworking, and all of these factors play into that. Thank you.
Thank you, Dr. Oliver. Be glad to take your questions.
Governor, on long-term care facilities, and this is also for Dr. Oliver, I know we talked about getting new information about exactly the number of outbreaks that are happening right now. Do we have an update on that? And then kind of bigger picture, Canterbury right now reporting 32 deaths. That's a large number. You know, can you give us kind of a state of how y'all are getting a handle on this issue with long-term care facilities?
Thank you, Henry.
Thank you. So as I understand your question, you're asking about Canterbury here in Henrico and the large number of deaths that have occurred there. Those deaths aren't reflected yet on the VDH site, so there'll be a discrepancy there. There have been news reports that the deaths now number 32. The Canterbury site, like other long-term care facilities, has a population that is at very high risk of mortality from COVID-19, and that certainly proved to be the case there. The local health department in Henrico and the management of Canterbury have done their best to isolate the cases as they can and provide distancing, quarantining those cases and so on to try to keep down the spread. I think part of your question is what is that sort of meant for us in terms of other long-term care facilities. And our local health departments are working very closely with long-term care facilities in their districts to really stay on top of what's happening there and increasing our surveillance of that. We've broadened our test criteria so that we could test more people in the nursing homes and other long-term care facilities. As more tests become available, we will increase our testing in those areas because it's in those sort of congregate settings that we think the risk is highest for the sort of thing we're seeing at Canterbury.
Do you guys have specific numbers yet?
I don't have specific numbers I can report to you now, but we should be able to gather that for you.
Yes, the first question will be from Roger Watson with the Farmville Herald.
Hello, thank you for taking our questions. Prince Edward County officials say they have a PPE shortage for first responders and some other county agencies. Is this something the state can help with, or are the counties on their own to get those supplies?
That's a good question, and the question is there are localities, first responders, et cetera, that don't have enough PPE, and the answer is yes, we can help. And as I mentioned yesterday, we have ordered a shipment, $27 million worth. We expect that to arrive in the next few days. But I would ask any locality, whether it be the firefighters, whether it be first responders, law enforcement, whatever, if you are getting toward the end of your PPE or don't have PPE, please let us know, and we will do everything that we can as we disperse this equipment across Virginia to take care of as best we can all of your needs.
Yeah, another question on long-term care facilities and nursing homes. I know that several organizations, such as Leading Age Virginia and VHCA, are concerned about staff sharing between different facilities. Given that, is the state willing and able to provide them with a list of affected facilities specifically so they can alert members, if there are facilities that might share staff and help mitigate transmission?
Your question is, are there facilities where if we know of individuals that have tested positive, that can be made public? Is that
Well,
what
just can the state release that even to the facilities themselves so that they're aware?
We actually do that. That was one of the things we did, for example, with Canterbury here in Henrico. We knew that staff were working in other facilities, and we let those facilities know specifically that they had staff working with them who might be vectors for having the COVID-19 appear in their facilities. And we did our due diligence in trying to contain that, and I think we did a good job. It hasn't spread to those other facilities.
And quick follow-up, in your latest clinician letter, you said that the guidance currently is that asymptomatic workers who may have been exposed can continue to work as long as they wear a face mask. Can you go into more of why that might be and why that guidance was issued?
So the question is, why would we have as part of our guidance to nursing home facilities, and for that matter to all healthcare workers, is that if they're asymptomatic, even if having been exposed to a COVID-19 patient, they could continue to work. Why would we do that? Healthcare workers are among the front lines in fighting this disease, and they are not of unlimited supply. And we want to keep them working as long as they can do so. In addition to monitoring their symptoms, however, some guidelines, if you look at the CDC, for example, they'll talk about things like checking for fevers and other things that can be checked objectively. Once symptomatic, then they would be quarantined.
Yes, the next question will be from Bill Atkinson with the Progress Index.
Very much. Governor, my question is to you. Will you consider issuing an executive order to relax the requirement that physicians' attendants must be supervised or consult with physicians so they can better help with the front lines, to relax this requirement in cases of emergency? I know that the American Academy of PAs has been pushing all of your colleagues across the country for orders like this, and I think so far 4 have responded. What would be your response to that?
The question is regarding PAs or physician assistants and their supervision by physicians. And this system has worked very well in Virginia. We obviously want to do everything that we can to work together as a team to make sure that we're adequately taking care of the patients. We want to make sure that our staff is available, that they're healthy, et cetera. I would just assume that as we move forward, whether it be in the hospital or nursing home or wherever, if there's a PA, there's a very good likelihood that there are going to be physicians as well. And so I don't anticipate. The question was whether I will be writing or signing an executive order to change that relationship between the PAs and the physicians. And at this time, I don't have any intention of doing that. I think the system, the way it's designed, the way is working very well right now.
Governor, can you talk about what types of patients are being prioritized for testing at the state labs and what percentage are being tested by private labs?
Okay. Dr. Oliver?
Yes.
Thank you.
So the question is what types of patients are being prioritized for testing. The criteria that we set for that is one that looks at people who have symptoms that are consistent with a corona-like illness, and also patients who have those symptoms and we don't have any other reason to explain it, like flu or some other illness that could explain those symptoms in a hospital setting or in a nursing home setting, and in any patient who's 65 or older.
And what percentage of the tests are being conducted by private labs?
That I don't know. Do you have that information, Dr. Tony? I don't know. We know how many tests we have, but we don't actually know how many tests the private labs actually have.
The next question will be from Bruce Potter with Inside Nova.
Thank you. Governor, nearly 45% of the state's positive cases are up here in Northern Virginia, and the Washington area has been mentioned among cities that might be hit the hardest over the next few weeks. Are there any specific hot spots for the virus that you and your team have identified in Northern Virginia? And what are you hearing from the hospitals up here in this region about their ability to handle the projected surge of patients?
The question is Northern Virginia and certainly the density of our population, and what am I hearing from our hospitals and what are they doing to prepare for the surge? First of all, I will reiterate that the mayor of Washington, D.C., Mayor Bowser, the governor of Maryland, and I have been working very closely. We have tried to be consistent in our guidelines, especially the stay-at-home, social distancing, et cetera. We realize that the greater Washington area is at risk to be a hot spot. As far as any particular areas in Northern Virginia, I mean, that data is available. We've obviously had cases in Fairfax, Arlington, Alexandria, and we would be glad to share that with you. But as part of the question, what are the hospitals doing? We are preparing for all scenarios, and I think we've outlined a lot of those plans. But I want to commend the folks for the greater Washington area and in our case, in Northern Virginia, for really doing a good job in following the guidelines. I've had reports that have come back from various areas in Northern Virginia, and they're taking this seriously. And the key here is that if we can continue to follow those guidelines, we will do what we need to do in flattening this curve, and we'll put a lot less of a burden on our hospitals. But I will tell you, in just talking to the CEOs from our hospitals yesterday, they're ready. There's no question they're being taxed. They're working very hard. Their healthcare workers are coming to work every day. They're worried about PPE. They're worried about the testing, all of the things that we've been talking about. But they are prepared to take care of Virginians in the event that this surge occurs, and I'm proud of all the work they're doing.
So Maryland is sending these so-called strike teams to help nursing homes with care, with supplies. Given the crisis at Canterbury, is that something you all are considering as well?
The question is about strike teams in Maryland, and I would say that if you go back and look at what we've done, we're essentially doing the same things. We have been very aggressive on making sure that we isolate individuals at the nursing homes. And I think the point that needs to be made, a couple points that I'll make. First of all, we're so sorry for those that have lost loved ones, not just in the nursing homes, but all the Virginians. We regret that, and we're doing everything that we can to keep Virginians safe. But the challenges that we're having in our nursing homes, I think, speaks to a couple things. One is how contagious this virus is when it gets in a confined space like that. And it also speaks to the challenges that all of us as governors have had, and that is the lack of PPE, which we are continuously working on, and also the difficulty with the testing. And that gets better every day. But if you can only imagine when there's an individual at a nursing home or anywhere that we think may be positive, and this lab test is sent to one of our private labs, for example, and the turnaround time is 7 to 9 days, that it really ties our hands. And so there are a lot of challenges, but I will tell you that, and I commend the Virginia Department of Health, and I also commend our nursing homes. It's a difficult situation, but they're doing everything that they can to keep these individuals safe.
Michelle Hankerson with WHRO.
Hi, we're hearing from a lot of self-employed folks who have had trouble applying for unemployment benefits. I know the VEC has amended their process for people who are self-employed, but I was wondering if those applications will be expedited. We've heard from people who have applied multiple times. They're reaching a really critical point financially. So I was just wondering if there will be a special expedited process for them, and if not, what they should do.
Okay, I'm going to ask our Chief of Staff to address that. Clark, thanks.
Thanks. Well, the question was about individuals who are unemployed and seeking assistance from the state. I would point out that nationally and at the state level, we are seeing record numbers of unemployment. So that is stressing the system federally and at the state level. I think the governor on Monday announced that we are doing an overhaul of our various websites and databases to accommodate the incoming calls and requests. Our 211 call center, we are using monies from the federal government, the Relief Act, to add individuals to answer the phone and get back to folks. And I will also say, and more in the coming days, but we are very mindful of individuals who have lost their jobs and the small businesses that are affected. And we are looking at different options over the next several months to make sure we can get those folks the aid that they need and the working capital that businesses need to hire back and hire back quickly. So thank you.
Yeah, I'm wondering if the state continues to actively investigate the Canterbury facility. If you have any more insights about what could have gone wrong there that, hopefully we can avoid in other facilities. And then also on this issue of PPE, I know that there's been some conflicting on federal lawmakers that FEMA has not prioritized Virginia. So I know that's a couple of questions there, but I think they're all, very important for the state.
Yeah, the first question is are there investigations on looking into Canterbury and what could have been done? I think I touched on the challenges that we've had, and they have been aggressive from the start. And I think the day will come in the future when people can go back and assess the various things that were done or could have been done. So we're right now trying to make sure that not only with Canterbury, we're doing everything that we can to protect those individuals, but to prevent this from happening in other nursing homes. But I will tell you, it's a real challenge for us. But we're doing everything that we can to keep them safe. As far as the PPE, it's a great question about has FEMA been slow to direct some of that equipment to Virginia? And I'll go back to what I said earlier. From the start of this pandemic, there has been limited direction from the federal level, whether it be from PPE, testing, ventilators, etc. And so every governor has been on their own. And we, as I said earlier, we're literally competing for that same supply. We're competing with other countries, we're competing with other states, we're competing with healthcare systems. And I think that Virginia, actually, I'm proud of what we've done to have the amount of PPE that we have. As far as what they have in their stockpile in Washington, we have requested a certain amount of PPE. Ballpark, I'd say we've gotten about a 10% of what we have requested. And in all fairness to FEMA, there are hot spots. I'm doing everything I can to protect Virginia, but there are hot spots such as New York, Detroit, New Orleans. You all know all the areas that are really being hit hard. So they're really directing a lot of their supplies to those hot spots. And you know, we're watching very closely. We're looking at the data every day, and there are a lot of people that are concerned that the greater Washington area may be one of those, you know, up-and-coming hotspots. And certainly if that happens, then I think FEMA will redirect some of their equipment to that area.
Thanks, Governor. I'm Bree Season from CBS 6. I've been reaching out to your office for the past month repeatedly, trying to get a feel on some of these 427 outstanding pieces of legislation,
Yes.
Several of which have never been more pressing to our viewers. So I'm wondering a couple things, if you anticipate doing anything, signing perhaps the Torian-Favola bill on ending balanced medical billing, Sickles' efforts on certificate of public need reform, and perhaps most pressingly to the financial viability of emergency rooms. There's a budget amendment in HB 30 that would downcode a lot of potentially Medicaid visits to ERs to $14 for these physicians in a day when they're fighting really hard to do as much as they can. Are those things that you're still considering at this point, and what are your thoughts on those three, especially because of the Saturday deadline?
Yes, the question is there are a number of pieces of legislation that we're continuing to study and that I will act on by Saturday. I would just say at this stage, I've acted and signed over 800 of those pieces of legislation. And I would just say to be patient. We're working through those. By Saturday night at midnight, they will have all been acted on, whether they have amendments, whether they're passed or signed without any changes, or whether they're vetoed. And all of that will be public on Monday morning.
A budget amendment specifically might save the state $14 million in Medicaid payments, which is, saving the state budget at this point is something you've emphasized is important, but it could affect the access to public health for a lot of ERs.
Yes, I'm going to make it a little bit clearer maybe than I did the last time. All of these pieces of legislation are important. We're working through those. Yes, I'm going to do everything that I can to protect our budget, but all of that will be released as of Saturday night at midnight. So thank you for your question.
Yeah, the next question is from Tracy Agnew with the Suffolk News Herald. Tracy? Okay.
Yes, thank you so much for taking our calls. My question is about testing resources available to medical examiners in the state. Reports from other states are that their coroners aren't able to test the dead who had symptoms of COVID-19 but weren't tested while they were living. So have medical examiners in Virginia been giving the resources necessary to do so that their contacts who are still living can be notified?
The question is whether we had the ability to, Dwayne, is Dwayne in here? When you get a chance, this microphone, I think, is out. But the question is, are we testing, or do we have the ability to test those deceased so that their family members can be notified? I don't.
To test
those that are deceased, whether they had COVID-19.
Okay, so the medical examiner is in the Department of Health office as the chief medical examiner. Cases that wind up at the medical examiner are cases that are not known to have had a natural death, so suicides, homicides, other things that are being investigated wind up there. And in that situation, I think that we could certainly consider the possibility of testing. That would be another situation where with increased testing capacity, we could add that as a criteria. At this point, we're not doing that, however.
I just wanted to add to what the Commissioner of Health has said, is that there are indeed patients that were tested at the time they were critically ill, and the test results were not back. And those are made available to loved ones when those results come back. So those results are made aware, the families are made very much aware of that test result.
Also, Dr. Tony corrected me. I misspoke. It turns out that we do, in fact, do the testing on cases that appear at the medical examiners.
Two separate things. One, we've gotten a lot of complaints from people who are working at either the essential or non-essential businesses that their coworkers have contracted COVID-19, but that they haven't been informed by their employers. They found it in other ways. What are the requirements for these businesses to inform all employees that one of their coworkers may have gotten sick? And then as well, any update to the UVA surge data report that you were expecting?
I'm going to answer your second question first. Any updates on the surge data coming from UVA? We're continuing to work with UVA, University of Virginia, and they're continuing to collect data that is specific to Virginia. And I don't want to make any guarantees, but I think in the next day or so we'll have a lot more information on that particular model. They're getting very close to where they have the data to be able to make predictions. You want to address the other question, Clark? Thank you.
The first question was about individuals that are working in businesses and have concerns that employees might have gotten coronavirus and have not been informed by their employers, and that is an issue nationally. We have DOLE, the Department of Labor and Industry, here in the Commonwealth, and that's the first place for folks to call or email or go online and make such a complaint. And then DOLE works with the federal government to address those. A call from our commissioner of the Department of Labor will get a business owner's attention. But I would say a few days ago, we received word that a couple individuals had contracted coronavirus from a Virginia business, and we heard about that through the media. And I would say, one, thank you for the job that you're doing. It's important, and you're looking into important issues. And so we're grateful for that. The first thing that I did when I heard about that was get in touch with that business and cite our displeasure that we would hear from the media about these cases. It's incumbent on both the government and private sector to be transparent and to be proactive if we're going to get on top of this and we're going to be able to get out of this and quote unquote get back to normal. So it's a two-way street. Obviously, there's a lot of folks who are working who are stressed, and if they feel that they're in a workplace where their employers are not being receptive to the social distancing, our Department of Labor and Industry is the first place that they should go.
So they are required, though, if one employee gets sick, are they required to inform everyone else that there has been?
I don't think they're required to, but I think it would be common sense if you're in a workplace. We have protocols that we would share with certainly we abide by the state government, that if an individual contracts coronavirus in terms of cleaning, distancing, whether or not we let the public into certain buildings. And so common sense would tell you if you're in an office and someone has contracted that, I think management needs to be proactive and let their employees know.
The question is from David McGee with the Bristol Herald Courier.
Yes, thank you, Governor. A two-part question regarding the election. I saw in material from your office that you're suggesting that the absentee ballots already cast be discarded, so I was wondering why. And second, given the proximity of the election, might you call the General Assembly back in a special session to act on your request?
I'm going to let our Secretary of Administration, Kiana Connor, address those two questions. Thank you. Thanks, Kiana.
So the question is about absentee ballots that have already been cast. Virginians should know that every voter will have an opportunity in November to vote for those offices that were to be on the ballot in May, in addition to all other ballot offices in November. So in November, there will be one ballot, and voters will have an opportunity to vote for all of those offices then. So absentee ballots that have been cast to date will be discarded.
Other questions about a special session? I guess I can answer that. The second part of that question was, would I call a special session? And the legislators are coming back on April the 22nd, and we will ask them to take up the issue of moving the May elections to November. So that will be part of their job when they return on the 22nd.
Governor, as you know, we broadcast in all of Hampton Roads, of course, in Lynchburg, Roanoke, and we've been getting some concerned calls concerning the African-American community, wondering if your administration was prepared to maybe produce special messaging PSAs for the African-American community, also opening up some of these community centers that are closer to people of color. These centers are closed, maybe opening them for testing and information, and lastly, making sure that federal funds are used to help to get these messages out to the African-American community.
The question, and I appreciate your question, was how can we better communicate with the African-American community, and for that matter, all communities. And we do have an Office of Diversity, Equity, and Inclusion, Dr. Janice Underwood, and I will pass that recommendation on to her. We, as you may know, we have done a number of PSAs, public service announcements, but I think to your point, it would be a good idea to let people know all the things that we're doing for the different communities. So I'll take that certainly into consideration as we move forward. Yes, and Dr. Oliver would like to comment as well.
I mentioned that in the unified command we stood up as a whole of government response to the COVID-19 pandemic. That unified command has a health equity work group that's part of the overarching general command. Okay, so it's at the highest level, and as a cross-cutting function, it looks at all aspects of our work, and one of those aspects is our communication campaign. We have what we call a joint information center that is putting out PSAs, videos, other communication things, and we're sitting down now mapping out an entire campaign that will be directed to the African-American community, looking at what to do about the Latino community and other vulnerable populations, making sure that they get messages around this that are appropriate and easily understood and help get the message across. So all the points you made, I think, are very important, and we're definitely working on it.
If I can follow up real quick. Also, there are members of the self-employment community who kind of struggle with getting their applications processed. They feel as though the system is not ready. One of them said that they were told that we are flying by the seat of our pants. We don't know how to really structure all of these claims, if you will. did your secretary speak to that earlier? The self-employment community, the self-employed community.
And we can make sure to, again, put out the websites and the phone numbers. We do have individuals here to help with those issues, and I know it can be very cumbersome for these people to navigate the system. And I don't have the website or the phone numbers, but I want to make sure to get them to you. But encourage folks that do need assistance that we are here to help with that. Any other questions?
Just to clarify for the data, the racial and ethnic data, are you going to be able to get the data for those tests that have already been completed, the 53% that's already on the board? And again, these are just, I guess, suggestions to the private labs, not a direct order?
Well, that data is not, if the clinician, if I was ordering a test on a patient I was seeing in the office or at a clinic or at the hospital, if it was not included in that original data, I don't know of a clear way to go back in time to get that. I think the best that we can do is to do the things that the Commissioner of Health indicated. One is to get all of the provider community to supply that information on the front end, and Dr. Oliver indicated how when there are complications, God forbid, like folks passing away from COVID-19, that we capture that data as well. So I think it will be difficult, and I'm not sure of a mechanism to go backward in time.
Just in closing, a couple points that I wanted to make. First of all, you see, and you've heard from a number of individuals that get up in the morning. Half of them are staying up at night as well, for that matter. But they're very talented. They're very hardworking. And just on behalf of Virginia, I think you can all be proud and should know that these individuals are working very hard for you. The other thing I wanted to say is I really do appreciate your all's questions. I don't have answers for everything, but when we hear these questions, it makes us think of what more we need to do. And whether it's input from our legislators or our local officials or just the public in general, we appreciate your input. We appreciate knowing what you're dealing with out there as we all work through this together. So please continue to give us your input. That's why we do what we do. We want to help you. And as I've said every day, my main goal right now is to make sure that we get this health crisis behind us, that we keep all of you as Virginians safe. And just as soon as we can get this crisis behind us, the health care crisis, our economy will bounce back, and all of us hopefully can get back to our lives as we knew them before COVID-19. So again, thanks to the press. You all are doing a wonderful job covering this. I thank you on behalf of the Commonwealth, and to all of you out there that listen to us when we do these press conferences. I thank you, and I look forward to being with you again on Friday. Thank you.